Today's topic, in fact, today's discussion has multiple things involved around your lungs. And I think with the COVID, this is very important also for us to understand how your lungs work, what is, how to take care of it, what are good, what are not. And today we are going to have the specialist about it. If you have questions, keep posting. Hi, good evening.
Okay. Yeah, good evening. Good evening.
Yes, how are you doing?
Yeah, I am all right. How are you?
Great, great. Thank you so much, first of all, for your good time and just
Yeah,
for your
and
information. Great.
yeah, I thank you also for taking such initiative, because this is a time where a lot of awareness is required related to present COVID scenario, related to a lot of chest related disease, as well as how to improve fitness. So it will be a great session.
Yes, hopefully, looking forward to a lot of information and help to people. So we've been doing this knowledge series from quite a long time. We stopped in for 2 months for some reason. This was
Yeah,
actually people's request to start again. We normally host the
great.
specialty, and we love people to have the right information to particular topics.
Yes,
All right, so
great,
friends,
great.
we have Dr. Milan Modi with us today, who is a pulmonologist and allergy specialist in Surat. He has received his DNP in chest medicine from Lilavati Hospital in Mumbai, and he has worked 3 years of training with the very eminent Mumbai chest physicians as well. He's received his fellowship in bronchoscopy from Tata Cancer Hospital, and he has also done his advanced training in sleep study and snoring workshop from JC Suri in Delhi. लवली सर, आई थिंक बहुत कम लोगों के पास इतनी सारी नॉलेज एक साथ मिलेगी. He is one of the best allergy specialists as well as the pulmonologist in Surat. He does practices at Majura Gate by the name of Dr. Modi's chest clinic. Am I right?
Yeah.
I hope I have not missed out any of this important, credible things that you already
No,
carry.
so that is all okay. See, being a doctor, we have to learn a lot of things.
Of
So
course.
apart from this
So,
discussion, but in general, are you able to see me
I
and
am,
hear me properly, or it is
I
breaking in
am, I
between?
am, I am able to hear you. Yes. So friends,
Okay.
lungs related, COVID related, allergy related, आपके कोई भी questions है, feel free to keep writing in the chat box, add in the comment, and we will surely take it one on one. Right. So tell me, what are the most common allergies and the chest, allergy problems that you in everyday practice?
So, see, in chest point of view and allergy point of view, and in this present scenario, the most common problems we see is coughing. Patient, a lot of people are having prolonged chronic cough. Another problem is breathing difficulty or chest tightness or chest pain. Apart from this, lot of patients also suffering from asthma, tuberculosis, or post-COVID related bronchitis, where patient may have kind of some kind of weakness or some expectoration, or having persistent coughing, or when they become when they walk they have tiredness. These are common cough problems. Apart from this, also post-COVID lung fibrosis is a major problem. And in chest also we see patient of snoring also. So these are the in general patient, but majority of patient usually present with complaint of coughing, and few of the patient might have rhinitis, like sneezing and runny nose related problems. So these are the major things patient we see.
Does the COVID induce the snoring as well?
No, snoring is a completely different disease. It is not related anywhere near COVID. Snoring is,
Stronger than
see, no, snoring is a normal phenomena. It is not a disease. But when with the snoring, patient get choked at the night. Because of choking, patient may develop oxygen hypoxia or decrease in oxygen level. Because of choking, patient will have poor quality of sleep. And because of this poor quality of sleep, patient of snoring keep on sleeping during the daytime. That is called as obstructive sleep apnea. Snoring is a normal phenomena. Let me again tell you, snoring can happen with anyone who is completely very much tired. That can happen. But if this snoring choking happen, and
Hmm.
patient has a complaint of excessive daytime sleepiness, these are the patient who are pathological snoring, which is called as obstructive sleep apnea, which needs to be addressed properly and treated properly.
Right. So, what is the difference seen with the COVID patients having Omicron and those of the previous strains?
Yeah, so in present scenario, I think lot of people are knowing about difference about Omicron and present past COVID. But to summarize thing, I think recently Bill Gates has mentioned this thing in his interview that this is the end of epidemic, kind of, because like the Omicron virus, which is actually very infective. It has a doubling time of 2 to 4 days. Means in various places in Europe also, means it is infecting people like anything, and it is one of the most infective virus or organism world has ever encountered. But good point
Hmm.
is this Omicron virus get localized into the throat and it does not go into the lungs. So most of the patient with infection with Omicron does not develop pneumonia. They only develop cold and upper throat related problems. So blocked nose, sneezing, running nose, severe body pain, weakness, throat pain. But they usually do not develop significant breathing difficulty or hypoxia. So that is
All
very good
right.
point. And by this way, they develop a good immunity. It's kind of mass immunization of world kind of.
Yes, we are in need of herd immunity.
Yeah, that is hard immunity.
So I wanted to know, do we also see the mix of Delta variants or the Omicrons in some people? Are we seeing them?
See, in general, all the patient of COVID positive does not undergo variant testing. It is done by the a research laboratory and the data collection laboratory who randomly take samples for the data analysis. So out of 100 COVID positive RT-PCR, how many are Delta variant, how many are Omicron? According to that, they take a data. We are not actually in practical clinical scenario. We are not aware about exactly which patient is Omicron positive or Delta positive. But in general, the recent data shows in last 2 months almost 70% of Delta variant has been replaced by Omicron variant. So, in general, what we in clinical practice have seen is, I think 9 out of 10 are Omicron infection because they do not develop pneumonia and they are, very mild and within short period of time they get recovered. So we assume that this must be a Omicron.
How many days of isolation that we expect with the Omicron?
Yeah, so see, previously it was recommended to have 10 days of isolation because that was a very dangerous virus and it was showing infectivity for the prolonged period. And we wanted to, curtail the infection in a strict, aggressive manner. In present scenario, the infectivity is high, but the severity is very low, and
Yes.
infectivity period is also low. So, in general, the government guidelines say that after the first fever or the
Hmm.
test positive, home isolation for 7 days is required, and last 3 days there should be no fever. The
Okay.
absence of fever suggests that there is no active viral infection happening. So 7 days is a in general duration, but if patient is having persistent fever, then the isolation should not be discontinued. It should be continued. And if any patient has a fever for more than 5 days, then it should be they should at least consult telephonically or physically if feasible to the hospital or a doctor consult, because this Omicron variant does not have a fever for more than 3 or 4 days.
Okay. So how about those people whose antigen test or RT-PCR is negative? The CRP is high and they show all the symptoms.
See, two things. If any of the family member had COVID positive report and you develop a viral kind of symptoms, please assume that 99% it is the same COVID infection you are developed. Okay. The sensitivity of a rapid antigen or RT-PCR is not 100%. It ranges from
Right.
60% to up to 85%. So if you are tested negative, that does not mean you are not infected. You are likely to be infected if your any
Relying
of the
on
family member is positive. Okay, for COVID. If it is there is no positive COVID around you and still you have viral infection, then you may assume that this is another viral infection which has produced the upper respiratory tract infection.
All right. So it can be anything because a lot of going negative yet have all the symptoms probably there. So what are the
See, I
major
must,
changes?
no, apart from this, I must add you one thing. See, in this present scenario of Omicron wave, a lot of people are self-testing by rapid antigen test, and they are doing rapid RT-PCR also very rampantly. I think it should be avoided. See, if we when we used to have common cold, we do not do any
Mm,
test. In general, when we talk about 4 years back, let me tell you this Omicron or COVID, it's a coronavirus. Okay. This coronavirus is not a new virus. This
mm,
coronavirus is producing cold since last 40 years. Same virus. But because of some, very drastic mutation in this 2019, it has produced a COVID virus, SARS-CoV virus. And because that COVID virus, which was only coronavirus, which was only producing nasal infection, had developed access to the lungs and developed a pneumonia. So the virus is
right.
same, which is producing cold since 40 years. Now the Omicron virus has again converted the SARS virus into the same mild virus which produces common cold. So this is the
Right.
same common cold we used to develop 4 years back, and we do not have to get worried very significantly unless if our age is more than 60 or we have severe diabetes or any other comorbidity like heart disease, liver disease, kidney disease, or we are on immunosuppression drugs, or any point of patient where the infection may destabilize the underlying disease and patient may develop chances of hospitalization. These are the patients who come into the high risk category.
Right.
They might need to do RT-PCR, rapid antigen after advising by doctor and get a
Okay.
proper treatment. Otherwise, common people with common cold should not get worried and should not test self-tested rapid antigen and RT-PCR.
Right. Just as some countries have already declared it to be a flu and is going to stay forever, we also need to start
Yeah,
accepting.
yeah,
Right. So, into other thing, if someone has already had the delta, had a variant suffering, now is encountering if he develops some breathing difficulties, what is the line of treatment for them?
okay. See, so basically, we define treatment line into three parts: mild, moderate, and severe disease. Okay, the mild infection, which can be treated at home, does not require any significant treatment except antipyretic, means paracetamol for fever, proper hydration, hygienic food, proper amount of sleep, and a small breathing exercise or stimulation can be very helpful. This is one mild category which can be treated in up to 90% of patient, 90 to 95%.
Okay.
Second category is moderate disease where patient oxygen may drop down less than 93. These are the patients who require hospitalization and that can be treated in ward only. Okay. And they may require oxygen support plus steroids as an immunosuppression because COVID produce inflammation in the body. So they
Right.
require IV steroid, methylprednisolone or Lexona, and that can be switched to oral therapy. And during this course, they will require oxygen therapy, steroid plus second thing is antiviral medications that can be remdesivir injection. Okay, and if a patient is fitting into the oral therapy, then molnupiravir tablet or favipiravir. But the favipiravir results are showing that it might not be very effective, but still it can be used. Okay, so these are three antiviral: remdesivir, molnupiravir, and favipiravir. Then
Mm.
third treatment is anticoagulant therapy because lot of COVID patients develop blood clotting, and so we
Yes.
need to treat them empirically before they develop blood clot. We give anticoagulant so that blood does not get clogged. For that, we use low molecular heparins. So these are the three for the moderate therapy, moderate patients of COVID. And if patient is severe, where the oxygen is less than 90 and patient is having breathing difficulty, these are the patients who will require ICU setup. They require oxygen support. They require NIV or BiPAP machine with mask. In case of very severity, they may require ventilator support, full ventilator support, and the same therapy, steroid, remdesivir, and anticoagulants like Lexan or this low molecular heparin is the therapy of choice. But in these few selected patients who are indicated showing the severe disease, we can give tocilizumab after proper criteria has been selected, and it is approved by government also. So these are the line of treatment in general. It's a medical or everything explained in general. But
Right.
good part is
So,
95% of patients are doing very well without any major treatment required.
do they have the persistent cough for a longer period of time, like long COVID that we hear?
Yeah,
Is
yeah,
there
yeah. So
something
that is called.
existing?
Yes, yes. So basically, what happened is, like when COVID happened, it involved two part of the lungs. First is airway, and second is lung parenchyma, proper lungs, where they produce small pneumonic patches. These pneumonic patches get recovered spontaneously, okay, but that airway involvement, which produce swelling of the breathing tubes, which is called as bronchitis, can persist up to 3 months to 6 months also. So, a lot of patients who are having a past history of allergy or who are having prolonged cough history or having bronchitis complaint or smokers, they tends to have continuous coughing even after COVID has been recovered. That is called as post-COVID bronchitis, and that needs to
Okay.
be treated properly. Otherwise, patient may develop other further complication related to coughing.
All right. So, does the pulmonary rehab helps, or is it suggested?
Yes. See, I think pulmonary rehabilitation has a, very unique role, and we need to increase awareness about this rehabilitation for all the patients. See, orthopedic department, we have dedicated rehabilitation. Patient after recovery of fracture, they always go for the rehab and how to use muscles and everything. But the same kind of result or maybe higher kind of result can be achieved in almost every disease. When patient is having critical disease in ICU, we give reference to physiotherapy for the rehabilitation. Same way, when patient recovered from COVID, severe COVID, they usually develop pulmonary fibrosis, breathing related problems, muscle wasting. These are the
Hmm.
patients where we can give pulmonary rehabilitation reference, and patient can recover faster. Same way, just in orthopedic, patient recover faster with rehabilitation. Same way, lung patient also recover very fast with rehabilitation in proper observation. Apart from COVID, there are a lot of lung disease which require proper dedicated rehabilitation, like severe COPD disease, where breathing capacity is significantly decreased. Then pulmonary fibrosis patient who cannot, having breathing difficulty and muscle wasting, it can be improved. And third very common is bronchiectasis, where patient has, small pockets in the lungs where sputum get collected, and they usually have lot of coughing and expectoration. This can be trained properly, and this expectoration can be removed. And because of this rehabilitation, the chances of infection decreases 3 times. So that is very significant. So these are
The
the patients which can be.
Surat,
Sorry.
do we have the pulmonary rehab centers in Surat? Something,
Yeah,
something.
see, yeah, we do have pulmonary rehab centers. There are 2 to 3 private setups, as well as there are a few hospitals like Mahavir Hospital where there is physiotherapy department doing dedicated rehabilitation center. But in general, what happens with pulmonary rehab is usually a pulmonologist get involved into rehab center, and they instruct the physiotherapists how to do rehab for this specific patient, because all the rehabilitation has different modules.
Right.
Some patient may require breathing muscle strengthening, some patient may require expectoration removal. So according to that, we have coordination with the physiotherapists dedicated for the pulmonary rehab, and we have center.
Okay. Great. So, what are your take on the Ayurvedic or the other line of treatments for either the COVID patient or the lungs patient? I mean, people really have. Does
See,
it harm while the case?
we cannot say, and we should not say that one therapy do harm rather than benefit, because if that therapy was not effective, then that science would not have evolved. So all the therapy, whether we take is as a allopathy, what most of the doctor practice, or homeopathy or Ayurvedic, all therapies are meant to be helping the patients. Only thing is that doctors should be properly, knowledgeable and experienced to take care of that patient in a rightful manner. sometimes what we have seen is, few of time the homeopathy therapy or maybe in Ayurvedic therapy, there are a lot of adulterants, means there are a lot of heavy metals or some kind of drugs, things which is added which may not be recommended by the therapy and which may harm the patient in few of the patient. Second thing is, in this kind of scenario, we have also seen that sometimes patients do not follow regularly with the doctor. That could be the major problem for the organ damage or kidney damage or this kind of problems. If a doctor do regular follow up and they keep on checking proper reports, then usually the complication does not happens. If and patient should follow a rightful doctor for proper honest treatment. So in that way, I think everything is beneficial. But I would say, I'm doing allopathic practice, but I would say that Ayurvedic science is a wonderful science which helps to cure disease for the long run. But a lot of time, patient and general population does not have that much of time, kind of patience to get that thing done.
Right. So, Dr. Modi, I also have read in Indian Express recently that the COVID patients now have showing the new symptoms of skin sensitivity.
Sorry, I did not get your question.
So I read in one of the newspapers that COVID patients nowadays are showing the skin sensitivity.
Yeah, so that is hypersensitivity that happens. It was happening with the previous infection also. Basically, this patient develop pain or itching when some very increased itching and pain on touching the patient. That is normal phenomena with lot of other infection. It is, I think, nothing extra which need a focus.
Okay, do they not need to see a dermatologist for cutaneous hyperplasia?
See, I think after the viral infection goes away, within 5 to 7 days, this cutaneous hypersensitivity also get decreased and get resolved. Only case of few of the severe disease like Steven Johnson syndromes or cutaneous severe manifestation of cutaneous COVID, they may require dermatologist opinion, but not most of the patient.
Right. So what are the types of allergies that you see?
See, basically, allergy can involve any part of the body, and allergy patient can have a lot of symptoms from headache, itching of eyes, running of nose, throat irritation. Even few patient can have joint pain, body pain, lethargy, lot of things. But we can classify allergy into four major parts. First allergy is a nasal allergy where patient develop a sneezing, running nose, blocked nose. This nose usually start from here till back up to the throat. So this patient of allergic rhinitis, this called allergic rhinitis, also develop itching of eye, pain in the eye. They also develop headache because that sinus get open into the nose. They also develop ear pain or secretions from the ear, and sometimes throat irritation also. That is all covered into allergic rhinitis. This is first category. Second category is allergic bronchitis, where patient inhale the allergen deep into the lungs. Because of that, patient develop a swelling around the breathing tubes, and patient
Allergic
develop coughing. Yeah, allergic bronchitis, coughing. Then patient breathing difficulty. They may develop chest tightness, breathing problems. These are called as allergic bronchitis. Second category. Third category is skin allergy, which is called as allergic urticaria, where patient develop itching. After itching, that swelling increase and it keep on spreading. That is allergic urticaria. And fourth type of allergy is gut allergy, where patient develop dyspepsia or bloating of stomach, or diarrhea or vomiting kind of sensation, even they if some minimum amount of food. These are the four major kind of allergy based on disease category. But what is the cause of allergy? Based on that also we can classify. It can be food allergy, it can be aero allergy. Aero allergy is either dust allergy or pollen allergy or animal allergy, or it can be contact allergy, where ornament or pet contact with pet can produce allergy.
Yes, so there was a question related to it from Mr. Vikas. He was asking that his baby of 1.5 years has a dust allergy and he wants to know how to take care of it.
See, First, we need to find out, as I told, what is a part kind of organ involvement with the allergy, whether it is nose, whether it is breathing tubes, like coughing, or whether it is skin related rashes, or whether it is gut related patient is developing diarrhea or something, if maybe. So we need to identify which organ is involved with the allergy. Second, we need to find out what is the severity of allergy, and according to that, we can treat the allergy. And most of the time, in children's, in pediatric, also small babies, milk is one of the major cause of allergy. Milk and wheat, these are the major. Doodh or gehu, these are the major cause of allergy. So we might need to replace them with the alternative foods after consulting with your pediatrician or allergy specialist.
तो यूथ nowadays there is a trend, you must be knowing, internet पे all over होता है, gluten free stuff, go vegan, no dairy kind of things. So what do you have to say about it?
See, I think the time is changing. There was a time 40, 50, 60 years back where everything was allowed, everything we can have, eating of everything, and people used to have a lot of hard work also. This time is changed where the sedentary lifestyle has increased, stress has increased, pollution has increased, food habits has gone haywire. Fast food is the first food, and the normal food is the second food. So because of all these things, the normal lifestyle which was set by our Indian culture has completely changed, and even it is in the Western. I think we are following Western, and Western is now following the Indian tradition. Vegan has been started in Western. They are seeing the evidence that milk is one of the major cause of allergic problems. Milk is one of the major cause of autoimmune problems. It is the one of the highest cause of diabetes. Also, recent papers are showing there are a lot of papers which show that milk is not a normal food nowadays. I can tell you 3 or 4 points, which hello, it's a very simple point. In world, human is the only animal which consume milk of other animal. There is no animal can consume. First thing. Second thing,
So check.
so these are common point we all know, but we have to accept that, and we might have to change our diet habits. Second point, milk is consumed by all baby, up to 4 years, not more than 4 years. So second point. Third point, previously, if we think 100 years back, when milk was a natural food habit, it was a natural milk where cow used to provide a natural excessive milk. But now the demand has significantly increased, and I think a lot of time it is induced milk where the injections are given to cow, and so that is not a good product. And it is also showing that A2 protein is not there, and it's a A1 protein which can be harmful. See, this is the research papers I am saying. I should not, disturb anyone's emotional statement, because lot of time when we discuss about milk, lot of people say, sir, milk कैसे बंद करने का, दिन में 2 बार पीते, रात को हल्दी डाल के milk पीते. So that is very different thing to challenge, discuss.
Bought up as well as history चल रही है. एक दूध नहीं पिया तो आप रोटी नहीं खाते हैं तो आप सेहत नहीं है. एंड अभी जो ट्रेंड आ रहा है वो ये पूरा अपोज कर रहे हैं. देयर आर एक्चुअली द रिसर्च ओवर इट. सो देयर आर पीपल कमिंग टू अस आल्सो एंड से नहीं ये पॉसिबल नहीं, इसकी ना ताकत ही नहीं आएगा.
Yes. So same thing with the
फैमिली.
yeah. So that is the same thing.
Yeah. So okay. One question: what are the tests, allergy tests, that if I'm thinking, I might be sensitive to certain things, or I am intolerant to a particular food, might be allergic. What are the tests that one should go through?
See, first and most important is when you are suffering from any kind of allergy, you need to get consultation with allergy specialists, where history and examination is very important. By that, we kind of find out what is the organ involvement of allergy, what is the severity of allergy, and how we can treat allergy. First point is history and examination. Second point, when we are sure that these are the few point of allergy which can be there, then we test that allergy with some blood reports, and if we want to confirm the specific allergen, what is the exact cause of allergy, that can be done by skin prick allergy test. That is called a skin prick test. It is a painless test. It is not, we do not probe, we just scratch a skin with the drop of allergen put on the forearm. if patient is allergic to this particular allergen, for example, I put a drop of milk protein and put a scratch and patient develop significant itching, redness and erythema, then it is showing that this is an allergy to the
Right.
patient. And by this
Okay.
way, we find out what is exact allergen. That is called a skin prick test. And based on that, we can provide a therapy for the allergy.
Right. So does the allergy ever go away or is it cured?
See, there was a time, I think it's required a lot of explanation. There was a time, maybe I can say 10, 15 years back, where people used to say that allergy का कोई treatment नहीं है, allergy जाएगा नहीं. Now the time has changed. I think that with changing in time, lot of newer therapy, newer treatment, newer knowledge, and newer experience comes into play. Same thing has happened with the allergic disorder. Now I cannot say that allergy जाएगा नहीं, इसका कोई treatment नहीं, ऐसा नहीं होता है. Allergy has specific treatment. First line of treatment is avoidance of allergen. When we do proper allergy test, we can come to some proper conclusion that these are the food allergen. If you just avoid that, you will be absolutely all right. You will get cured. I had one patient of a lot of patient, but one patient of 4 year girl. First allergy test when I had done, she was significant allergy to milk. She had just left milk and all milk products, including butter, ghee, cheese, paneer, everything. Within 1 year, her inhalers get stopped, her nasal problems get resolved, and she improved weight significantly. So that is a classical example of just avoiding after
Why?
SPT skin prick test was done. So first treatment avoidance. Second is if allergy is mild, very minimal, we give a proper treatment for 2 to 3 months. By this 2 months of treatment, almost 50% of allergic disease can be completely controlled or almost get cured. Third category where patient does not respond to this treatment also and patient keep on developing continuous problems related to allergy, we give allergy test. Based on that, we start with the immunotherapy that is called as allergy vaccine, which needs to
Hmm.
be given either sublingually or through small injection. And by this also, almost 70% of allergy patient can be properly cured. It has
Right.
significant results. See, previously, a few years back, the standardization was not there for the allergy test. It was not there for the immunotherapy or allergy vaccines. Now it has improved significantly. Papers are showing that allergy skin prick test or allergy test should be offered to allergic patients who are having persistent complaint. Recently, WHO guidelines also has recommended if patient of asthma or allergy should be underwent allergy testing.
राइट. सो ये जो लोग हैं जो आते हैं हमारे पास बिकॉज इवन फूड एलर्जी टेस्ट आर सो कॉमन. थायरो कैसे हो जाते हैं, मेनी अदर लैब्स आर डूइंग द कंप्लीट प्रोफाइल ऑफ इट. सो मेनी ऑफ द पेशेंट हु कम्स फॉर द न्यूट्रिशन प्लान आल्सो दे हैव 10-10 साल पुराने एलर्जी टेस्ट में थोड़ा सा माइल्ड पॉजिटिव दिखा रहा है काइंड ऑफ. And they say कि हम तो इससे एलर्जी के, we are not going to eat and we have not eaten them since ages. So I
Yeah.
wanted to know from you, Dr. Modi, that there are people who have
Hmm.
done their food allergy testing from so and so years, maybe 10 years back, 5 years back, or maybe बचपन में करवाया है. When they come to us for the
Hmm.
nutrition, we bring that. ये सारी चीजें खाने में मत रखना बिकॉज वी आर सेंसिटिव टू इट, या फिर हम एलर्जिक है, हमने किसी से खाया ही नहीं है. सो सेल्फ डिसीजन, सेल्फ ट्रीटमेंट्स काइंड ऑफ थिंग्स. तो वो चीजें कितनी हमें बिलीव करनी चाहिए, एरर करनी चाहिए, या उसको कितना ट्रस्ट कर सकते हैं.
See, ब्लड एलर्जी टेस्ट रहती है, वो दो टाइप के टेस्ट रहते हैं. वन टेस्ट which is rampantly getting done by patient or even lot of time doctors also is ELISA test, and it is getting advertised in lot of papers also. But
Yes.
let me tell you, it has not been approved by international bodies because there is lack of standardization for that test. Which is getting done, I think, under 5,000 rupees, where they test almost 200 or 150 or yeah, they do lot of testing. Let me just give one example. I had patient from Ankleshwar who has done 4 times this same test from the same laboratory in 3 years duration. and all the four tests are showing different allergic results. Some was showing lemon, some was milk, some was wheat. So, and I have a lot of example of patient where it does not clinically get correlate. They are getting allergy to rice. That is not, their rice allergy is not very common. So that taste is not accepted by international body. I also never see, I never take any decision based on that taste. But if you really want to do a blood allergy test, then the test is called as immunocap or Fadiatop allergy test, which is getting done by some of the internet well standardized laboratory like SRL. It is very costly test where in 9,000 they just check 35 to 40 allergens only. That can be reliable test.
Okay.
Okay. So in blood test, this is a reliable test. Rapid. Most of the people who are doing, I should not say the laboratory names, which is getting advertised in the paper, is not reliable. There is no purpose of doing that test and wasting money, practically speaking. If you really wants to confirm some allergy, then the gold standard test is skin prick test, where immediately when we put allergen and patient develop reaction, that is 100% sure your body is telling that you are allergic. And it has
Yeah.
been approved by international body that skin prick allergy test is a gold standard test. And based on that result only, we take a decision of giving any immunotherapy or allergy vaccines.
Right. So, is there a possibility a person has one kind of allergy can develop a different allergy as well, or it can induce
So you mean to say one allergy is there and then they develop second or another allergy also?
develop, but one allergy induce the other allergy,
Yeah.
or
See,
it can
basically allergy.
have the secondary allergy?
Yes, definitely, definitely. See, basically, if a patient has a allergy related to nose, almost 40 to 50% of patient of allergic rhinitis or nose allergy have breathing bronchitis also. They also have allergy of lungs also. Uh, 20 to 30% of this allergy patient might have in past or in present scenario related skin allergy also. So allergy can be mixing each other also. First thing. Second thing, the allergen which are there is specific component. It is usually fixed allergen, but allergy itself is a hyper reactive immune system. Sometimes it is just showing allergic to dust. Over a period of long time, patient may develop allergy to other food particles also. So it's a immune malfunction. So he may develop
Right.
multiple allergen.
All right. All right. So, one last question of the day. How about the treatment, or maybe the patients coming with multiple allergies, and how do we know that they have celiac disease or something?
Sorry, actually, your voice is getting break. Can you repeat again?
Am I audible now?
Yeah, you are audible, but not clearly. Can you just please repeat again?
So I wanted to know, the last question of the day was about the celiac disease. The patient comes with certain allergies or reactions. Kind of, how do you analyze? So I was asking about the celiac disease. The people carrying the celiac, condition, their allergies, symptoms, reactions, and the
So basically, a lot of patients of this celiac disease, they have gluten-related intolerance, they have lactose-related intolerance. So basically, it's a gut allergy where injecting some specific kind of protein produce allergic reaction into the gut, and it produce pathological disease. The same thing what I told, four type of allergy, there is four type of allergy where gut is a problem. And after once this is diagnosed in a proper biopsy way and blood reports, they should avoid specific food which can produce a worsening of disease.
right. All right. So, Dr. Modi, I've taken quite a long time from you, I think an hour of yours. Thank you very much for giving such a wonderful information and educating our viewers too. And with the COVID, you've served so many patients. We know them personally. Wish you more success. Keep serving the society.
Thank you so much. Thank you so much for this
One last,
wonderful session, and I thanks all the participants also for having active interactions. Thank you.
thank you so much.